Thanks for staying with us. So joining us on the phone is the Associate Professor from the Nigerian Institute of Human Virology, Dr. Patrick Dakum. Good morning, sir. Are you there?
Yeah, good morning, and good morning to your team and viewers.
Good to have you on the show. All right, so we're going to go straight to a few updates on COVID and just share some knowledge with us. I'd asked this question a few weeks back. People are saying that the reason why we have quite an impressive number of people who have recovered from this virus is because we had the BCG vaccine growing as children in this part of the world, and the fact that we've treated tuberculosis also in Africa. As a virologist, do you agree with this theory, or do you think there are other factors that is helping us have quite a good recovery case number in Lagos, in Nigeria right now?
First of all, thank you very much, and I believe that quite a lot has been said related to why the infection doesn't seem to be as virulent as it is in other countries. And one of those reasons is what you have alluded to. But for us, especially those of us in virology public health, we keep trying to point out to the fact that we're still too early to conclude on whether there is any immunity or not related to past vaccinations, related to climate, or related to our color. First of all, the issue of being black has been debunked by the fact that a lot of the mortality we see in the U.S. Is coming from the African American community, the black community. Professor Robert Gallo is one of the co-discoverers for the HIV virus, and recently he has been on air talking about the fact that using the vaccine, BCG vaccine or some other past vaccines may provide some level of immunity, but there are still things that are still being studied. There's quite a lot of research going on the kind of antibodies that are being produced, whether the immune response of coronavirus will generate the same kind of cells, in layman's language, that you have in other disease entities.
Right.
And therefore, the antibodies that they have would now work for the coronavirus.
Okay.
I think for us, it's still too early for us to make that assumption.
Okay. All right, go ahead.
Yeah, sorry. These antibodies you are talking about, you know, earlier on they had spoken about chloro-quine, and you know, Nigerians, over the years, we've built the immunity against malaria because we have been taking chloro-quine since time immemorial. That's one. Two, we have a lot of herbs that are anti-malaria herbs, like Dongoyaro, you know. Do you think that these help, and do you think it's something worth looking at?
Well, first of all, hydroxychloroquine definitely has shown some positive effect in a small cohort of patients on the trial, but the number was still too small for any conclusion related to whether indeed it provides a cure or not. And a lot of large-scale studies are ongoing now, and I believe some of the studies that are ongoing in the Lagos State response is also part of that. So we will not discard anything, just like the Presidential Task Force has been reiterating, discard any form of claim, but we will need to investigate this claim. We will need to put it on the trial, a clinical trial.
Right.
See, this is one thing that people need to realize, that 80% of those with this, like you have also been airing on TVC, 80% of people will have very mild symptoms. So whether they take Gary, or whether they take vitamin C, or whether they take anything, those 80% will still get well. And therefore, people can lay claim. But if we can now subject it to a proper clinical trial where we see the effect on the virus itself, then we will be able to conclude.
Dr. Patrick, I wonder why virologists like you and your colleagues are not investigating some of our traditional methods of treatment. Now, this is a respiratory infection. The virus attacks the respiratory organ. And our mothers would have done the cook in agbo kind of steaming, where they put the herbs in the pot and make their children stay over it. And we've survived other viruses in the past. Why are we not looking towards this side of treatment?
Already there are many people that have laid claims, and the relevant ministry already is taking it up, and they have told us publicly that they are going to be investigating all of this to be sure of which one has real potential or not. Let me tell you, when I was a little kid, I had a yellow eye, and they told me yellow fever. Guess what was given to me and what they claimed to have, my mother told me caused the cure. They had to make pepper soup of lizard with a red head and put a lot of pepper in it in order to enable me inhale it, and then at the end they said that I got well. Of course, when you take any steam, when you do steam inhalation, it relieves you of the symptoms of respiratory disease. It does not mean that what you put in the steam is the solution. It's the fact that it is steam. But we insist on studies that should be done scientifically so that we can replicate it to others, so that we can find out the dose, so that we can find out the side effects. You can imagine Dongoyaro, where it is, they will tell you to take a bottle. Many people had complications. But when we now came to extract it, it became the ingredient that is now being used for anti-malaria. So traditional medicine is not bad.
Right. All right. If we look at the numbers abroad, you see that most of the fatalities are actually the elderly, between the 70s and 90s. And there's also a line of thought that the reason why we don't see so many fatalities in Nigeria is because we don't have a huge population of the elderly. I mean, we have a 70% youth population. Most of our what's our life expectancy in Nigeria? Is it at 58 years? So maybe that's one of the reasons why our numbers are not growing as expected in the East, because the international community have predicted so many times. They've given us various in 4 weeks, in 6 weeks. We've done like 2 whole months, and the numbers haven't reached nothing close to what they're dealing with in other parts of the world. So in your view, what's the cause of this? Would you say is the fact that we don't have a huge elderly population?
Lack of text.
In terms of infection, no. But in terms of mortality, yes. In terms of mortality, if you look at why are we having a lot of community transmission, and we're beginning to find out a lot of people. And what is the age range? The age range is below 40 of people that are currently being infected in Nigeria. But in terms of mortality and the way the virus works and the way the virus makes the interstitial cells within the lungs to glue together, when you have an underlying disease, the tendency for that to be is higher. So people that have underlying disease or diabetes, high blood pressure, cardiovascular disease are mostly in the elderly age. And therefore, for them, the mortality is high. So if we can predict, we may say that, yes, the mortality may not be that high in Nigeria, but it is definitely going to be there. And the reason why we say that we have to be very cautious is because if you look at the case fatality rate is how many people died out of those who have the disease confirmed. And if you look at it in Nigeria, it's hovering to about 3%. In some other places where they have high number of people that have the infection, we have their case fatality going at about 1 to 2%. However, we may also be very cautious about just a cut and paste interpretation like that, because we need to also look at the number of tests that have been done. Because if you look at it, it is not that much. Why are we seeing more cases now? Door-to-door testing is going on now in FCT and in Lagos. And if we go with that,
Dr. Patrick, I'd like us to stay on this issue of testing, because YK did mention it, that the reason why we're not seeing the numbers because of we're not testing as much. But we've seen also outside the country that it's people who are showing symptoms that they are testing. They're not just going door-to-door testing everybody. So if you show symptoms, you come forward and you get tested. Here, it's almost like the strain we have here is such that most people are asymptomatic. They don't even have a clue that you have it. So is that also a problem? Because if we have lots of asymptomatic patients in Nigeria and everybody's getting it, do you still think that we're going to have that galloping numbers going forward, or fatalities, or we can still just heal ourselves? Our immune system can actually heal the virus itself?
The purpose why we need to test almost everybody is because we need to identify it, whether you have mild and when you will recover tomorrow or whether you will not. Why? If for example, if I pick the virus and I don't have any problem, I'm going to come back home. I'm going to infect somebody. the people that are staying around with me may get infected. They will leave. They will infect somebody, and that somebody may now end up being the one that will die, especially if you will visit an elderly. And there is no way in our tradition that you will say that your mother came from the village and you tell her, stay at the door, let me spray you, or let me do this, or quarantine her to one room. Our social structure is so that we have got to be more careful, because maintaining social distance is more difficult in our situation. And when we say that they are doing door-to-door testing, I don't know the protocol they're using, but some form of screening is taking place. From preliminary of what I've heard out here, so many people were seen, so many people were screened, but so many people were tested. So not everybody that was screened got tested.
Right.
So the fact that they call it door-to-door does not mean that they are just saying, everybody queue up or get it.
Okay.
Now, also, let us debunk this idea of saying that the other countries are only testing symptomatic. Not necessarily so in all places. If you look at Germany, for example, they even have stops on the, like a bus stop, where people will get tested. They are sitting in their car, you put the swab in their nose and swab.
Well,
and
what is confirmed is that we are overwhelmed already. Our test kits are not enough to go door to door. That one is confirmed. Our health minister has alluded to that. States are complaining about that. The NMA too have talked about not having enough.
So let me tell you what my idea is about that. My idea is that, number one, is that, first of all, just like we said that we don't have no test kits enough, we have also had certain laboratories that have the capacity to ramp up to X number that have not yet reached half of their capacity. So it means then that we probably still have redundancy. Every state has a primary healthcare agency. The national has a National Primary Healthcare Development Agency. Now, the units at the lower level are the primary healthcare centers. Every primary healthcare center in this country should be a sample collection point. Should be
that we have in abundance.
Where you collect samples and then you transfer those samples in a safe way to a particular testing center. So while we are ramping up testing centers, well, we say that we need to have one per state, but I believe we need to have much more than that per state, given the way this pandemic is going. Then they will now collect the samples and take it, and then there will be a proper logistics system that has got an electronic base, that this sample is coming from this primary healthcare center, it is tested, the results go back electronically on the cell phone of somebody that is in that local government.
Right.
So if we have a machinery that works from THC right up, I think we'll be able to deal with the issue.
All right, Mikey.
I'm a bit confused, because if you are asymptomatic and you're not showing signs, they don't test you. They will not test you. That means you can be spreading the joy. So this is a bit confusing for me.
So don't get confused. First of all, the majority of people will have symptoms. That is very clear. Number two is that when we say that we should have sample collection centers in PHCs, we will use the structures in that place to encourage everybody, whether you are symptomatic or not, to just walk in and do a test. If you look at it, those were some of the methods we used for HIV. You know, they show for face. People were not sick, but we were encouraging people, look, have you had a test? And eventually we got to the point where a lot of people are tested. There's still a gap up till today, but we were able to at least reach a point whereby we could now begin to narrow it to only pockets of certain places now.
Right.
So we can do the same thing. If, for example, we have billboards everywhere, have you had your COVID test? Have you had your COVID test? Walk into your nearest PHC center. When you go there, within 4 or 5 minutes, they have put a swab in your nose, and then they have taken a swab, taken your details and address everything, and you go away. A lot of people will get tested and will be able to know what the burden of disease is.
So there's a tweet that says, please, 15 people are being tested daily in the local government, and the governor said that the results we told will be out in 7 days. How many days exactly would it take to get a result after the sample is taken?
Right now, in the testing centers have close to a 24-hour, 48-hour turnaround time. But you see, we are trying to move forward. If you had the presidential task force, they are also saying that the number of testing sites we are ramping up as rapid as we can. It means then that there is going to be more testing centers and more tests going on. And so as we ramp up collecting samples, we are ramping up the number of places where these tests can be carried out. I remember that in my state, for example, when the testing center has been activated in Plateau State, the National Veterinary Research Institute, and the governor said there that, hey, look, they have a capacity to do about 1,600. Now they only have about 300-400 samples now. I know that it is just because it is the beginning.
Right. Okay,
but
let me ask you.
An example that we can do it. It's possible.
Excuse me, sir. You know, if we find the cure with our herbal medicine, this one that oil is 000. You know, we can use this one to make money in Nigeria. So I advise that we really look into our herbal medicine, because
we are not going to discountenance
it will become oil
medicine. But I want us to understand that traditional medicine should be subjected to scientific tests so that we will be sure of what we are giving the population.
All right, we have to round up very soon,
okay.
but I have to. Well, I'd like you to help me address this issue of the various strains of this virus. We've been hearing on international media that there are various strains in different countries. Is there any research to know the type of strain that we have of COVID-19 in Nigeria and its properties and what we should be careful of or not? I mean, we're getting all sorts of information across board in international media that there are various strains out there.
Well, I think the strain that we have here is still the SARS-CoV-2, and that a strain that has been imported. We don't have evidence that there has been any major mutation in the strain that's here. Remember that this virus is not indigenous here, and therefore we do not have. We can't say here is the Nigerian strain.
So we cannot go through mutation here. It can't be mutated in our own.
No, it can. But what I'm saying is that we have not yet seen a description. We've not heard of a description of the genotype, the way it is here. That is the, how do I put it in a layman's term? The genetic makeup of that, the gene sequence, the sequencing of the virus in Nigeria, whether the sequence has changed or not, we don't know.
Right.
But I think it is something that a lot of people are looking into it. I know that the virology lab here in Abuja, they are trying to look at the sequencing. Right. Okay. And they are also trying to look at that in Lagos also.
Yeah. All right, we have to wrap up now. Thank you so much for joining us on the show today. We appreciate your thoughts this morning. We've been speaking with the Associate Professor from the Nigerian Institute of Human Virology, Dr. Patrick Dakum. That's all we can take on the show today.
We are finished already?
We're done.
Wow. I just wanted to say, I wanted to thank God for my auntie and my uncle who are much better. You know, they had coro.
Oh, really? In UK?
Yeah, in the UK. Oh. And my uncle, because he had an underlying illness, he was tested, but my auntie was never tested. But they just stayed home drinking
tea.
Whatever.
Okay.
Oh, so they got tested and they had...
My uncle got tested, my auntie didn't. She just showed the signs. They don't test you there.
Yeah.
Unless...
Yeah, you show signs. That's what I'm saying. Even...
My auntie showed signs. They still didn't test her. They don't test you.
All right, that's all we can take on the show. We'll see you tomorrow. Have a fabulous day. Bye for now.